Mechanical ventilation in asthmatics is fraught with danger, which is why we do everything we can to avoid it. But if you run into the situation where you need to intubate the patient, embrace a permissive hypercapnia strategy to avoid doing any additional harm. Patients with asthma have prolonged expiratory times. If you set that respiratory rate on the high side to blow off CO2, you're going to end up with breath stacking. As the patient gets increased breath stacking, lung volumes increase and intrathoracic pressure increases, and that can result in one of two things. Either the pulmonary venous return drops to zero and the patient has a cardiac arrest, or you pop a pneumothorax. With permissive hypercapnia, we set the respiratory rate low and we allow the CO2 to stay elevated. That results in longer times for these patients to exhale and avoids that breath stacking. The easiest way to do this is to set your respiratory rate to 6 to 8 breaths per minute and set your flow rate to 120 liters per minute. That combination decreases the amount of time it takes to blow in the breath and increases the time that the patient has to expire. Once our meds kick in, that bronchospasm starts to abate, we can increase the respiratory rate and blow off that CO2. But early on, resist the temptation to set that respiratory rate high and blow off that CO2 and embrace permissive hypercapnia.